Welcome back to our EKG learning series, and today we'll talk about Epsilon wave. The definition of Epsilon wave is very easy, which is a small deflection at the end of the QRS complex. We usually see a very small, if we have an Epsilon wave, we will have this small positive or negative deflection just right after the QRS complex. It is best seen if and evaluated in V1 and V2. And on standard 12-lead EKG, it is best seen, as I said, like V1 and V2, but usually can be seen as well in V3 and V4. So they are, as a rule, when you want to evaluate for Epsilon wave, look for V1 to V4, which is the anterior leads. All right. What is the cause of the Epsilon wave? Epsilon wave is actually caused by excitation of the myocardium of the right ventricle. So sometimes there are infiltrative diseases or diseases that affect the muscle of the myocardium of the right side and causing the muscle to be fibrosed. And we will have islands of normal cells inside this infiltration. And so when the ventricle contracts, the electricity or the excitation will reach these islands really, it will be delayed. And when they are excited, this will be reflected as an Epsilon wave on EKG. Actually, if you see an Epsilon wave, it is very characteristic and is the most specific finding for a disease called arrhythmogenic right ventricular dysplasia. In this disease, the ARVD, the myocytes or the myocardium of the right ventricle is replaced by fat. And when it's infiltrated with fat, you will have viable myocytes that are floating inside this fat. And when the electricity will be delayed to reach these cells, once they are excited, they will show as an Epsilon wave. And this is really very, very characteristic for this disorder. But we also can see Epsilon wave in other diseases like sarcoidosis, for example, amyloidosis as well, or even if we have a right ventricular infarction in which the muscle has been replaced with fibrosis. And when it's replaced with fibrosis, you will have the same physiology in which there are some islands of viable cells within these fibrous tissue that can give you Epsilon wave. Now, that being said, there is another way to look for the Epsilon wave in more, and you will show these Epsilon waves more obviously. That we go with something called Fontaine lead placement. What is the Fontaine lead placement? First of all, let's know what is the importance of Fontaine leads. So Fontaine leads usually will increase the sensitivity to see Epsilon waves. What we are going to do here, we will get the right arm lead and put it over the manubrium. And we get the left arm lead and put it on the xiphoid process. And the left leg lead, we will put it here at the fifth intercostal space, mid-clavicular line, just at the site of the normal V4. This is a modification of the normal EKG and is called Fontaine EKG. When we place these three leads here, we will have Fontaine 1 with right arm and left arm leads. We'll have Fontaine 2, F2 from between the right arm and left leg, and we'll have F3 here down. Okay. Those three leads, the F1, F2, and F3, will increase the amplitude of the Epsilon wave because they are looking directly at the heart. They are not far away. All right. So let's look at this EKG here. If you like, this is a Fontaine EKG. You can't tell. You have no idea how to tell, but you can order it, and the technician can do it, and you can just look at it. Look here. The Epsilon wave is really prominent in V1, V2, and even in V3, but not in V4 or V5. And this can help you diagnose patients with infiltrative diseases or arrhythmogenic right ventricular fibrosis, as we talked about earlier. And that's it for Epsilon Web. Thank you.